Hi, Clark Tanner from Thrive Physical Therapy. Got a question from a patient the other day that asked me, why do I get leg symptoms that run down my leg when I stand or when I walk for a period of time? So I thought I would try to explain it. So here's what happens. Essentially, the vertebrae right back here, okay, lower lumbar, L4-5, okay, the nerves that come from that level give you sensation to this area of skin. So back of the rear end down into the leg. So when we stand up, what happens is, and this might be hard to pick out on the video, but when we stand, for a variety of reasons, like tightness in our hips, lack of thoracic mobility, multiple reasons, when we stand, it tends to put our spine into more of an extended position. So it's probably hard to see on the video, but when we go into extension, okay, in a normal spine, that narrows the amount of space of the exiting nerve roots and also down the central canal. Okay, so that's in a normal spine. So when we go into extension, anything that pulls us into an arch, we're going into extension. In a normal spine, that narrows nerve space. If you happen to be one that has a little bit of wear and tear, and you're starting to get a little bit of narrowing of these spaces, like from degenerative changes or disc herniations or spinal stenosis, all of those things that sometimes people are told they have, that means that you have a little bit of a narrowing of that space, so you become more sensitive to a reduction in that space. So when you stand, when you walk, we go into an arch, it tends to create a little bit less space for those nerves to exit, and sometimes when they're irritated, it'll start to give you symptoms down the leg. So that's the reason why we get problems when we're upright. That is a very typical presentation of people's symptoms that have general wear and tear. Now, that's the why. How do we help it in regards to physical therapy? Lots that can be done. First is gain hip motion. The better mobility you have in your hips, the more you're able to keep a very nice neutral lumbar spine rather than an arch, okay? The other thing is thoracic mobility. Our thoracic spine is up here, everything that has a rib attached to it. So if we have an increased curve in our thoracic spine like this, and we can't extend, then we will typically, if you got a curve here, you will typically extend our lumbar spine to make up for what we don't have in our thoracic. So the answer, help you gain thoracic motion. Okay, so lots of things that can be done about reduction in nerve space, lots can be done about disc herniation, spinal stenosis, degenerative changes, all of those sorts of things. And many of it has its origins in gaining mobility in certain areas, gaining strength in certain areas. But essentially, you improve what's happening, improve the position the person's in, and guess what? You help get rid of, or either eliminate or get rid of leg symptoms with walking and standing. So that's the why leg symptoms, and that's what you do about it. Thanks for listening. Have a great day.